Hi, thank you. Thank you, everybody, for first being here. I really appreciate your time. One of the big problems with veterinary medicine and pet ownership is vet visits. And a lot of animals, most animals don't like it. So that leads us, myself included, to not bring them, which is less than ideal. They need to be seen by a vet, physical exam, blood work, all of their meds. So we're going to talk about some ways to decrease the anxiety when you do have to go to the vet and make it a better experience. And in my world, an experience I'm willing to do. So why? Why do animals not like the vet? Well, there's a lot of different reasons. Bad things happen. They're really, if you think about your average vet visit, there's surgery, there's parts removed. I always wonder what they're thinking when they walked in with more parts than they left with. Sometimes that hat or that cone happens, which for some animals is just, breaks their spirit. Car sickness is a big problem. If you got sick every time you got in a car, you certainly wouldn't want to keep getting in the car. If they don't feel well, or you're going for a sick visit, then you're starting with an animal that doesn't feel well in the first place. There are dogs there, which is okay for some dogs, but most cats and some dogs that don't like other dogs will find that objection. There are bad smells that they're picking up, not just the ones that we detect, but them as well. And myself and most of my cats would rather stay home. And it's easier just to stay home. So we're going to talk about some ways to make this easier, some reasons why this happens as well. One really important thing to think about when you're thinking about vet visits is to think about your own anxiety. We all have it at some point in our lives, and how your own anxiety affects you and affects everything that you do and how you can control it. So what I mean by this is, let's say, your anxiety is flying. When, you get to the airport, maybe you're a little anxious, maybe you're feeling a little stressed, and maybe if you've worked on it, you have some tools that you can use to kind of de-escalate that stress. And it could be anything from a game on your phone to calling somebody who's going to talk you down. And you can find that you can get yourself kind of back to baseline with that mild level of stress. Then when it comes time for the plane to take off and you're sitting in your seat and your stress escalates, it's harder to get control of it. So mild anxiety and mild fear can be dealt with tools. Severe anxiety and severe fear is much harder to deal with once it kind of snowballs, and it does snowball. I often use my example of going to summer camp. I did not care for summer camp, and it would start off with, in the car, my heart would beat a little fast, and I'd be able to calm myself down. As we got closer and closer to camp, the anxiety built and built until I had stress colitis half the way up the Taconic. So there are ways that you can kind of think about this to your own anxiety, and they go through the same exact thing. I see it in the clinic every single day. When they're with their owner in the waiting room pre-pandemic, they're okay. They're anxious, but I can still, get them to eat treats. And then we bring them into the back. And once they're in the back, the same treats that they were eating with their owner in the waiting room or in the parking lot, they now are poison in the back. So you can literally see that anxiety escalate. And once it gets too high, like when your plane's about to take off, you can't really talk yourself out of that level of anxiety when it gets to your, GI and your heart and you're sweating. Then you kind of need either pharmacologic intervention or just to kind of reset and go back. So if we can keep that stress low, then we'll keep it from getting to that stress colitis phase. The other thing to know about stress is that it makes everything worse. Stress and anxiety make physically things worse. It causes a steroid release, an endogenous steroid release that can actually delay healing and also cause some immune response. What we're finding with cats and their cats that have urinary obstruction is that most of this is actually coming from stress. It's not from diet. It's not from anything really but stress and being overweight. Also feline herpes. This is an upper respiratory feline kind of disease that they can spread back and forth. And you find in times of stress, I say, when my cats get stressed, they're always winking and sneezing. They get conjunctivitis and kind of an upper respiratory thing. So stress will bring out that winking and sneezing. It also feeds into pain and any pain syndrome they're having. And if you think about it, pain causes anxiety as well. When we're in pain, we're thinking, is this going to get worse? Is it ever going to go away? What does it mean? And they feed off each other. Once that level of anxiety gets to that level 12, plane about to take off, even our powerful injectable drugs in the hospital will not work. That anxiety is just too high. And we wind up giving them more and more. And then when they get home, they go to sleep. But they don't really relax once that anxiety gets that high. The best thing to do is actually reset and try it again another day. And we'll talk about ways to do that. So think about the mild, severe anxiety we can deal with. We can get on top of with some tools that I'm going to give you today. The really heavy stuff, once it gets really bad, it's game over. I mean, just scrap it and try another day. So let's start at the beginning. And if you've noticed from my bio, I am a cat person. I'm going to put that out there right now. I am a cat person, and my pit bull is part cat. But I always think about these cats every time they present at the clinic, and I put myself in their shoes. So I think if I haven't left the house in 4 or 5 years, now I'm sick. And then there's this plastic box. And somebody stuffs me into this plastic box, puts me in the car, which I don't even know what that is. And then I wind up sitting in a waiting room with dogs, cats, noise, smells. I'm being picked up in the clinic. And you know, a lot of your cats don't like being picked up by you at home. Some do, and then now a stranger's picking them up in the middle of a strange room. A lot of cats have osteoarthritis. We're finding out more and more. There's about 30% or higher of cats. So we're finding it's not always evident on x-ray, but I assume any cat over the age of 8 has some kind of arthritis. And stranger danger. This is Floyd. He's one of my cats. And if you came over to my house, you would not see him. He's afraid of all strangers. So imagine having to take him to the vet. Everybody needs a sedative. So how are we going to work with this? How are we going to make this better so we all can recover easily and not wait until they're very sick to take them in for wellness exams and to get examined by a vet? We're going to work with a bunch of behavioral as well as pharmacologic changes, better living through pharmacology. And I'm going to help you get these pharmacologic agents in too, because I know that's a problem, and it's a problem for me as well. So really what's important is to change everything, change the way we think about everything, change that plastic, horrible, stinky box that came out of the attic to a sanctuary. Practice. We talk a lot, and I'm going to talk a lot about happy visits. So this is Eli, my pit bull, and we do a lot of outreach. We go to vet hospitals all over and talk about things like this. And so what he thinks is every time he walks into a vet hospital, he's going to get pet, he's going to get some treats, and then we're going to go home. He loves the vet. Then you think about a cat, like Floyd here, who doesn't go that often, and usually when he goes, he loses some parts. So the difference between those is practice and their experiences. We're going to use early pharmacologic intervention before it gets to that stress colitis phase. We're going to use food and familiar smells. And again, think about you know, that's kind of our stress release for a lot of people too. Reducing their anxiety will therefore reduce our anxiety. And I can't express that enough, and how true that is for me as well. I'm in the same boat with all of these things. And that's why I work so hard to find these tools. And the other thing to remember is that each negative trip to the vet makes the next one worse. They remember this. So if they go to the vet and something bad happens, or they're handled in a way that they don't like, or their anxiety is that high, it's going to be harder the next time. And you found this, I'm sure, with your own dogs. You know, when they're puppies, they're all happy to be there. And then as they get older, you're kind of dragging them in the building a little bit. And that's because they remember those experiences. So that box, let's turn the box from a bad place to a good place. And this is relatively easy to do. So cats, for the most part, are pretty bright. They know when this plastic box comes out of the attic or the basement and has cobwebs and pee from the last visit. They know what's going down. And you know that this is true because you've probably had to cancel a trip or two because you couldn't get your cat in the box, or you were bleeding and had to take care of that. So what I do and what I recommend is to leave the carrier out all the time. They make beautiful living room decor. And I put a fluffy blanket in there, some toys. I throw catnip and treats in there, and it's a hangout at my house. You can usually find somebody hanging out. I have several of them. And when it comes time to go to the vet, I'm not pulling the box out of somewhere. It's been in the living room all the time. It smells like home. It's familiar. If you're in the market for a box, the ones where the top opens is ideal for a physical exam. And Floyd here is modeling one where the top comes off, and he actually stayed in the carrier for the entire exam. He didn't even have to come out. And I covered it with a towel from home that smelled like home, and he was very happy with some pharmacologic intervention as well. But those are really great, the kinds that open easily from the top. Then there's the super carrier, I call it. And it's you can put a Loop lounge in there, which is the Assisi Loop, which is a mat, which is really a wonderful product. They decrease pain and inflammation. The mat itself is rechargeable and portable. So if you put it in this kitty pod, which is this orange carrier here, you can literally lay the pad underneath, and they can continue to get that inflammation and pain and really feel good sensor. I use the Loop on my geriatric pit bull, and he loves it. And every time I put it on his neck, he falls asleep immediately. So it really feels good to them. This picture is a cat that was a friend of mine's cat who was at rehab, and it's a large room and they can go sit wherever they want. And it's hard to tell, but underneath this blanket in that corner is a Loop lounge. And the cat could have sat anywhere in the room. His name is Bernie, and Bernie, every time they were at rehab, chose to sit in that exact spot. So he endorses it as well. And he's a pretty smart guy. Consider pheromones. Pheromones are life-changing, especially for cats. There's a product called Feel Away, which is a pheromone that smells good to them. It's a nice smell and makes them feel better, makes them feel relaxed. Some cats respond to Feel Away and pheromone type products like it's catnip, and really it is instant. Some don't care about it. I've never seen, in all my experience personally, any cat have a negative reaction to it. It comes in a lot of different forms. It comes in a spray, so I like to spray either the carrier or the towel that I place on top of it 10 minutes before you put the cat in there. They make Daptil, which is the pheromone for dogs. They make a collar that looks like a flea collar that has it impregnated in there, and you change it every 30 days. And then there are diffusers, which you plug in like any other kind of room diffuser. We can't really detect the smell to it, but you can see in this bottom picture, Kevin is really appreciating the feel away. Kevin and Floyd, my two cats, actually sit in front of it quite often and yell at me when it needs to be refilled. I keep these in my house all the time, and some vets actually have them too. So pharmacologic, this is what we've been alluding to. And for me, this has been life-changing. Some of them you need a vet for, most of them, but some of them you don't. And I like to combine them. The really important thing to remember about a lot of these is that it's ideal to do a trial run. So give them the medication, see how it goes, see how they react, put them in the car. There are some over-the-counter supplements. There are many of them. Some that I've used, Xylokine, it comes from cow's milk. That's readily available. I've used that in my dog for thunderstorms and fireworks. They say that it combines with any other medication, and it can really help. There's another product called Composure, or any of the L-theanine supplements. A study was published 2 years ago about L-theanine really helping reduce anxiety in cats. So that might be a good one to try on either one. Purina makes a probiotic called Calming Care for dogs. It's a pouch of probiotic that you put in, that targets kind of the stress sensor, and you put it into their food once a day. It's really quite palatable. My Pitty loves the taste of it. And then there's melatonin, which a lot of people use as well. I don't personally have a lot of experience in it, but people have sworn for it. But the main thing that has changed my life and the life of many people and cats that I know, and dogs, is a medication called gabapentin, or Neurontin is the other name. This is a drug that's been used for many, many things, but it has this amazing ability to really make a cat happy to be at the vet. It actually does. Maybe not thrilled, but definitely a willing participant in the vet visit. This is a prescription, so you do have to have a relationship, and your pet has to have been to the vet and had a physical exam. But this is what has changed everything for me, and why I no longer shirk on my pets getting to the vet, is that no cat leaves my house without having a high dose of gabapentin given to them 2 hours before I have to put them in the car. And I have to tell you, I have seen this just totally change. I could tell you stories. We could be here for days once I start talking about gabapentin in cats. But I'll tell you how to get it in them too, because that's the big problem. But I mean, my cats, the main thing, besides reducing their stress, and actually my stress and getting them there, is that my cats get a better physical exam when I do take them to the vet. So I get more bang for my buck by giving them gabapentin before they come in, because now they can look in their mouth, they can look at their teeth, they can get a full feeling of all their joints, and an orthopedic exam. These are things that would not be possible with any cat, especially mine, without gabapentin. Dogs too. It's a really great drug for dogs as well. It combines with most other medications. Talk to your vet about it. It can go with a lot of different ailments as well. There's another product called trazodone. Humans use it as well. This also is a life-changing drug for dogs, primarily, although cats can take it too. Trazodone, and you can combine it with gabapentin. Trazodone is incredibly safe. And if you have had pets for many years, and your vet used to give you a sedative for your dog many years ago, that sedative was probably something called acepromazine, which you probably did not care for the results that you got. Your pet was still anxious, and then was like a dish rag that wouldn't move for a couple days. This is not that drug. That drug does not help with anxiety, and it's not an anti-anxiolytic. It also has a lot of negative side effects. These drugs aren't like that. You're not going to see that kind of stuff with your pet. You're just going to see a less stressed pet at the vet. This will also, giving these drugs before you get to the vet will help with that continuum of anxiety that we've been talking about. You can combine the two, you can combine them with other things, but it is not those older drugs. And then there's injectable drugs as well, and these will be given at the vet. They should be given early. A lot of the newer, or not so newer, but drugs are reversible. So we can give them in the clinic. They'll get sleepy. We can do whatever needs to be done. And then we can give them another injection that will literally wake them up. So they won't be groggy and out of it for days. You can also potentially, if you have an incredibly fearful animal, ask your veterinarian to potentially give these medications in the car. Your pet will have had to have been there recently and maybe have a physical, or at least be listened to by the vet, but giving them in the car. The other thing that I will mention more of is not feeding your pet before they go to the vet. And there's a lot of reasons for it, but it also will make sedation safer, and it'll make your veterinarian more comfortable giving that sedation earlier. So how do I get medications in? With cats, the dose I like for most normal, healthy cats, normal-sized cats, is 100 milligrams of gabapentin, which I'll talk to your vet about, obviously, but this is what I use in mine. And it comes in a capsule, and you can actually open up that capsule, unlike most medications, and mix it with something really delicious. My cats like ham baby food. It's a big hit. Tuna or tuna juice, a product called Churu, which comes in a tube, and cats go nuts over it. I have pictures of it for you. Fancy Feast broth, whatever your cat's into. Then there's something I learned recently that has worked like magic on so many animals in the hospital as well. We call it shake and bake. For small pills, you take a small pill and you just coat it in a thin layer of any kind of pill covering, a pill pocket, which I'll show you, pill assist, pill wrap, whatever you got online or from the vet, just a small coating. And then you want to use a probiotic from Purina called Fortiflora. They love the taste of this. I didn't believe it until I saw it myself. I said, oh, it's a probiotic. They're not going to like it. They love it. And then you kind of coat the pill that's coated in the pill pocket in the Fortiflora, like you would shake and bake in a little bowl. And then throw a couple Temptations with those shake and bake pills, and they will eat it. I'd say 9 out of 10 cats that eat dry kibble will eat it. It's really quite amazing. Other options for dogs: peanut butter, cheese, a small amount of liverwurst, pill delivery products like the Greenies makes the pill pockets. You can use a pill gun, like you see the picture here. I actually have one here with me. I do like a pill gun, and if you do use it, the one thing I recommend is using the rubber tip. Some of them have plastic tips which can kind of scrape their mouth, so I like the nice soft rubber tip. But how these work is you just put the pill in the rubber tip and it holds on to it. And then you can, so there's 2 ways you can do it. If you look at the pictures here of that Kevin, you want to hold a cat by their occipital bone. So it's the bone right underneath their eyes. And you can feel it when you hold on to it. And that gives you full control of their head. So if you hold that bone and have full control of their head, you can then kind of poke it into the side of their lips. When they open up, you put it kind of far in, and then there's a little plunger in the back that you push, and your pill comes out and goes right down their throat. The other way to pill a cat is to hold them again by that bone with your one hand, and then with your other hand, you can just pull down their bottom jaw. And if you tilt their head up, you can kind of toss the pill in and maybe push it in the back if you feel comfortable putting your finger in there. Be careful if you don't, use a gun. And then just kind of hold their mouth shut and rub their neck, and they'll swallow it. And then the pill will go down. I do avoid liquids in cats. Sometimes it's the only way to get pills in, but I really think it offends them to a certain level that I'm not willing to do with my own, honestly. Food, so again, not feeding them before they came in will also not only help with things like them being safer to sedate, but also them being hungry and wanting our food, which is a great distraction for fear, anxiety, and stress. Also, if they get car sick or get nauseous in the car, there's a great product called Serenia that is a prescription that you can ask your veterinarian for. It was made just for that. Animals that have car anxiety, that don't like the car, giving them a product like trazodone and or gabapentin, or both, and why it's so important to do a trial run to see which one works. If you need more, that will really help with that anxiety in the car as well. Some vets have yummy snacks, but I always bring my own because some animals have weird favorites, like George up here likes lettuce. On the bottom, that's a picture of Bernie again, eating a churro, which is that really great stuff in a tube. Sliced cheese is another good one. Whatever their favorite thing is, popcorn, Cheetos. Other things you can try are thunder shirts. Eli's modeling one there for you. It hugs them like a hug, like the weighted blankets actually. And for some dogs, it's life-changing. Some dogs don't care. I always try it because it's a no harm, no foul, and you can order it online. You don't need a prescription. If it's a healthy exam for a dog, exercise them before visit. Get the ants out of their pants. If they run them. If they play ball, or take them to the dog park. They will feel your anxiety, so either control your own anxiety, or if you can't, you may not want to be present. I'm a big fan of catnip. I think a lot of cats really respond to it, and I've seen it make unhandleable cats handleable. And bring something that smells like home, a towel, a blanket, a t-shirt. You may never see it again, so don't bring your favorite. Things have a way of disappearing in vet hospitals. There's also the other Assisi product that's really great that animals love is the Calmer Canine. I have a friend that it did amazing things for her dog's anxiety and her, therefore, relationship with her dog. It's a 15-minute treatment twice daily for 4 to 6 weeks, and it's very well tolerated. You can take it on the way as well. Significant reduction for separation anxiety is what they found with this product. And when we start thinking about these pandemic curbside appointments, a lot of places still not allowed in the building. So that's an area where you're separated for them, or if they're hospitalized as well. We see in the hospital a lot of separation anxiety as well. And it may help with other anxieties on top of that. And practice happy visits. So, you can play with the pre-visit medication for your dog should they need it. If it's just a little bit of mild anxiety, do happy visits. I always say bring them in, give them a treat in the waiting room, have somebody give them a treat. Maybe you can weigh them and then leave. And then they'll wind up kind of ending up like Eli and really liking the vet because they get a treat. And once in a while they get poked, they won't notice because they're eating something delicious. And again, with medication, do the same. With cats also, really important to do a trial run with those medications. The gabapentin may make them a little stumbly. Don't worry. You will see that will diminish as you handle them and as time goes on. And a little stumbly is much better than, high anxiety and the vet not being able to get a physical exam because your cat's having a bad day. I always say there's no such thing as a bad cat. It's a good cat having a bad day. And really, if you think about it, again, not leaving the house, being stuffed in a box, sitting next to a barking dog is a bad day for a cat. So do those trial runs if you're able to. And then also doing kind of happy visits and trial runs, desensitization. You leave the carrier out, put the cat in the carrier, maybe close the door, bring the carrier in the car, bring the carrier back in the house. And doing these kind of then start the car, then bring it back. Doing small kind of steps to really get them used to this particular action. So takeaways, drugs are good. Cats, dogs, pharmacologic intervention for this level of anxiety, for the vet visit once a year or once every 6 months is a really good thing. And like I said, these drugs are safer, better, and have much less side effects. Anxiety snowballs, so get on it early. Don't wait until, you know, your dog is lunging or peeing and just panicking. Practice always helps. Snacks distract. Whatever their favorite is, bring it with you and bring them hungry. And cat carriers, they make the perfect living room decor.